Prior to nursing visit, a call should be made to the patient to give the estimated time of arrival and the appropriate place to park. Take a few minutes upon arrival to review patient's history, physical, discharge summary, and face-to-face.
Hello. Hi, my name is Victoria. I'm a visiting nurse from Comfort Plus Caregivers. I'm looking for Miss Laura.
I'm Laura.
Hi, nice meeting you. Can I come in?
Sure.
Thank you.
Why don't you come with me into the kitchen?
Thank you.
Come on in here.
Thank you, Miss Laura. Is it okay if I put my bag here?
Yes, please.
Thank you. I wash my hands.
Yes, right over at the sink.
Thank you.
Proper hand washing procedure for nurses. Most germs that cause serious infections in healthcare are spread by people's actions. Hand hygiene is a great way to prevent infections. Every patient is at risk of getting an infection while they are being treated for something else. Even healthcare providers are at risk for getting an infection while they are treating patients. In this module, we will talk about proper hand washing technique that will help prevent the spread of disease. Step 1. Wet your hands. Step 2. Apply soap to your hands. Step 3. Rub your palms together. Step 4. Rub your hands over each other. Step 5. Interlace your fingers. Step 6. Scrub your thumbs. Step 7. Rub fingertips against palms. Step 8. Rinse your hands. Step 9. Use paper towel to turn off tap. Step 10. Dry thoroughly with single-use towel.
Nice meeting you again, Miss Laura. My name is Victoria. I'm one of the nurses at Comfort Plus Caregivers. This is my business card in case you're looking for me. The hospital asked us to come see you since you were recently there. When people leave the hospital, they send our visiting nurses to check on them, to make sure they're doing well, to teach them, to make sure their medications are going well. The goal of home care is to prevent rehospitalizations. Is this something you're interested in?
Yes.
Good.
I think I am.
Good, good. So before we do anything, we'll have to sign consent to say that it's okay for us to see you. Are you okay with that?
Yes.
Great. This is multiple consents put together on one page for ease of signing. The first one lists your rights and responsibilities. The second one says you're consenting that a nurse and a physical therapist are going to come see you. The next section is called release of information. What this means is that it's okay for us to share information with your providers who are directly connected to your care. And this is authorization for payments, saying your insurance, which is Medicare, pays 100% for this service. Nothing should come out of your pocket. This section says you're consenting for us to take a picture of you so that the caregivers know who you look like when we come to see you. Is that okay so far?
Yes, I think that's okay.
Great. This last session is asking if you have any advance directives. What this means is decisions you've made in advance in regards to your health. Someone would say, I have a living will, I have a power of attorney, I have a healthcare proxy. Someone would say, if my heart should stop, don't bother, let me go, which is a DNR. This is important because it allows you to make decisions when you are in your best state of mind. In case something happens to you and you're unable to make your decision, someone you chose and selected makes your decisions for you. Do you know if you have anything planned in advance?
No, I don't right now.
You don't. It's important that you get this done because in an emergency, you want someone that truly cares and knows what your wishes are to make your decisions for you. I'm gonna have you sign here and date, and then I will sign here and date. Thank you. Thank you. This next session talks about patients' individualized emergency preparedness plan. Most of the time, people don't think of what they will do in an emergency until an emergency happens. So what this section is trying to get you to think of is what you will do if an emergency should happen. So I'm just going to ask you these questions and we're going to fill it in as quickly as we can. So I know what your name is, I know what your date of birth is, I know you're female, I know what your address is, and you put down your emergency contact on your flow sheet so I know what your emergency contact is. And I know she's your daughter and I have her number already. Is that okay with you?
That's okay.
Great. In a tornado, where is the safest place to be in this house?
The basement.
Great.
Yeah.
So we encourage that you're in the basement, in the lowest level of a house where there are no windows. Thank you. How about in a hurricane or in a flood? Where is the best place to be in this building?
Probably on the second floor.
Good. In a hurricane, you want to be in the highest elevation away from the window. Thank you. And if something should happen and you had to run and take shelter in this neighborhood, where would you go? We normally suggest a church, a community center,
Yeah.
a clinic, or a hospital. What do you have close by here?
I have a church right down the street. I can
Great.
go
So
to.
that would be a nice place to go in an emergency where you can just run and take shelter. How about outside the neighborhood? Where would you go if something happened and you
I
had
would go to my daughter's house if anything happened.
Good. Or we also suggest the hospitals, which are not a bad place to go outside the neighborhood.
Okay.
Thank you. So this next session is asking us to classify you. If something happened, there's a thunderstorm, there's a snowstorm, and we have to delay your care, what class do you fall under? That's class 1, 2, 3, and 4. I think we can put you on a class 3 because you know how to do your own insulin and you're able to do some of your care. So if something happens in an emergency, we're able to delay your care for at least 72 hours. That's what this session means.
That would be fine.
Great. This is asking if your house was inhabitable and you had to spend the night somewhere, where would you go?
I would go to my daughter's.
Good. So we'll put your daughter's name down here and I have her address. I'll put it down here as well. Sometimes, believe it or not, people have nowhere to go. So they can either go to a motel, a hospital, shelter. These are all places where people can go. The other thing is sometimes people have medical devices that warrants the use of power or the use of a trained person. In that case, we ask them to go to a hospital for a non-emergent hospital admission. Good. So, do you have any assistive device?
No.
No cane, no walker? I think you have a walker, right? For when you go out, the rollator?
Yeah.
Okay, so you have a walker. Good. And you're diabetic. Do you have do you use insulin or no insulin? I think you have insulin on your sheet.
Yeah.
So insulin. And then you have no oxygen. You don't use any machine to sleep at night.
No, I do
Good,
not.
good. And I know you have a left foot wound. So we'll put that here. You're not on IV antibiotic. You're not on 2 feet. You're communicating to me fine. You don't have any intellectual disability. You're speaking to me well. and you are on a low carbohydrate, low fat diet. So I'm gonna put it down here. Thank you. So I'm gonna have you sign here and date, and then I will sign. Thank you.
A lot of paperwork.
I know our first visit is always like that, but once we're done, when we come for routine visits, it's not this long at all. So this is patient's fall risk assessment. This session is trying to determine how much of a fall risk you are. So I have your name down here. It's asking me how old you are. If you're greater than 65, and I know you are 1 or 2 years old, so I'll put 1 here for you. 3 or more diagnoses, you get 1. And you just had a fall 4 months ago, so you get 1. And you use briefs, so that gives you a 1 as well. And you have glasses on, so that gives you 1. In impaired functional mobility, you use a walker, you get 1. Environmental hazards, you have the scattered rugs around, that makes you a high risk for fall, so I'll give you 1. You are on more than 4 medications. And are you in any pain?
I don't have any pain right now.
Not right now. So based on the score I gave you, you got a 9. A score of 4 or more makes you a high risk for fall. You got a 9. So that tells me that you're a very high risk for fall. And what that means is we want you to be careful. Use your assistive device when you're walking. Get away from clutter. Ask for help when you need it. We don't want people to fall, because when people fall, it sets them back, and we don't want you to have a fall. Thank you. The next session is talking about home safety evaluation, and this is trying to determine how safe your home is. So if it's a yes, say a yes. If it's a no, say a no. So functioning telephone.
I have a telephone, yeah.
Adequate water supply.
I do.
Functional electricity.
Yeah.
Available refrigeration.
Yeah.
Adequate storage space.
Yeah.
Adequate food supply.
Yeah.
Functioning stove. Adequate heat. Sufficient outlet. Free of infestation. Do you have an active life alert?
No.
So that is something for you to think about, especially people who live alone. In case of emergency, you can always push it for help. And I tell my patients that even if you use it 1 time in your life, it's still worth it. You know, it might be a little pricey, but it's still worth it. The other thing you can do is to ask your insurance if they cover it, because I know some insurances cover it.
Okay.
And you live alone, and your daughters help you sometimes, so you have a capable caregiver as needed.
Yes, I do.
Good. You don't have any vicious animals. I don't see any weapons. You don't smoke, and you are cognitively alert and oriented. And this is a single dwelling house. In the bathroom, which I took a peek, you have a hand grip, a non-skid floor, and you have a seat at the sink. And in the toilet, you have the grab bars also. I don't see any electrical cords run on the wall, and I don't see any devices in water, which is good. You have adequate lighting throughout the house, and at nighttime, do you have any night lights to prevent you from falling?
I do. I have one in my hallway to the bathroom.
Good. And you know what your safety fire plan is? You have 2 exits, and you have a smoke detector in the house, and all your exits all your exits to the outside of the home.
I do.
Good. You have a scattered rag, which you talked about, and the pathway needs to be cleared. And do you use a hospital bed?
I do not.
No bed rails, no bedside commode. You have a walker, I checked that off. Do you have a cane as well?
I do have a cane.
I checked that off as well. No lift, no wheelchair, and no protective devices. So, based on my assessment, your home is pretty safe, except that the rag in the hallway poses a risk for fall. So it's important that you get rid of the rag there, so your walker can be safe when you go around.
Okay.
I will sign here. Everything you signed, there's a copy in this book for you, and it's for your keep. This book is for your keep as well. This is the office number if you're looking for anybody, any nurse for you to call. This booklet also contains some useful information and numbers. In your spare time, it's a good read for you so that you get yourself informed with useful information. But at any point, if you have any question, don't hesitate to call the office.
Okay.
Thank you for consent. Now, I have some questions for you. How old are you?
I'm 102.
Oh my God, that's so impressive. You look so good for your age. How tall are you?
5'5",
And how much do you weigh?
120.
Oh, no wonder you're 1 or 2 years old. Any allergies?
Tetanus toxoid.
Who is your primary care provider?
Dr. Long.
And which pharmacy do you use?
I use the CVS.
Bliss Road?
Yes.
Good. So apart from the walker, cane, grab bars, any other assistive device do you use?
No,
No, okay. And what religion are you?
I'm Catholic.
Thank you. So we're going through a head-to-toe assessment, trying to gather some information from you. Anything wrong, any confusion, any anxiety, any depression, any seizures, any headaches? No? Okay. How about your heart? Any issues with your heart that you know of? Hypertension, high cholesterol, anything else? No.
No,
Okay.
I don't think so.
Okay, great. How about breathing problems? Any breathing problems?
No.
Shortness of breath, laying,
Just if
sitting.
I go up the stairs too quickly.
Okay, so shortness of breath with exertion. How about your stomach? Any nausea, vomiting, diarrhea, constipation? No. When was the last time you had a bowel movement?
Yesterday.
And how is your appetite?
My appetite's good.
Thank you. Any trouble urinating?
Sometimes I leak a little bit of urine. I wear a pad.
You wear a pad. Thank you. And any open areas on your skin that you know of? Nothing. No bruises, no wounds. Great. You have wonderful skin. Any pain on a regular basis? Anything you take Tylenol for in the past 24 hours? Any pain that has bothered you?
No.
No. All right. The next session, I'm going to grab some vitals on you to see where your vitals are. Then we'll take a look at your meds.
Okay,
And
I
then,
have them in a box. I
Great.
put them all together.
great. All right. So we're going to grab a few vital signs on you. I normally check a blood pressure, left, right, and standing. The purpose of that is we determine if someone's blood pressure drops when they go from a sitting to a standing position. And that's called orthostatic hypotension. Most seniors have it, and it's one of the biggest reasons why they fall. So that's why we check 3 blood pressures. Your blood pressure is very good, 118/78. That's perfect. So we'll do a left, right, and standing. Thank you. The next thing we do is to grab your temperature. Very good, 98.4. And we grab an oxygen saturation on everybody. Nice, you're moving very good here, 99%. Thank you. The next thing is I'm going to do a quick assessment to see how you're doing. I'll feel for a pulse. Very nice and regular. Nice. What year are we in now?
2022.
Good. And what month is it?
It's June.
Good. Any confusion, any dizziness, any blurry vision, any headaches?
No.
I'm going to take a quick listen to your heart. I'll listen to your lungs. I'll listen to your stomach. And I'll see your feet and feel for the pulses as well, okay?
Okay.
All right. Nice and regular. Deep breath. Nice. And your feet. Beautiful shoes.
Thank you.
Pulses are all there, nice and warm, and it's not swollen. Thank you. All right. I'm going to put my stuff away, and then we'll go over your meds and then your hospital paperwork.
Okay.
Just want to go over what happened in the hospital. You went in on June 3rd and got out yesterday, and you had acute hypoxic respiratory failure. You had some chronic kidney disease, some hypertension, some diabetes, hypothyroidism, and high cholesterol. The reason for going to the hospital was you were short of breath and couldn't breathe, especially when you did work. When you went in, your oxygen level was 83%, a number that we like to see 93 or better. Your workup showed that you had COVID. So they gave you some oxygen, treated you for the COVID with some steroids, and then some of the medications took a hit on your kidneys, so they had to stop some blood pressure medications as well. Your sugars, when they checked, the numbers were good in the hospital, so they decided to stop some of your medications, and we're going to go over them. So now you're home, and they want us to keep an eye on your blood sugars and all the other issues that's going on. The other issue was you had initially gone with a foot pain, and vascular did workup on your foot. While you were in the hospital, they wanted to do some more testing, but you said no. So we're just going to keep an eye on the foot to make sure that it's not worse. Any questions so far as to why you were in the hospital?
No.
Thank you. Thank you. So now we'll go over your medications, and they're right here. Can you hand them to me?
Yeah.
So, in the hospital, you have no known drug allergies, which means that you're not allergic to any medications. You were started on 20 milligrams of Lasix. Do you have your Lasix in there?
I think I do.
Thank you.
Yeah, here
Thank
it is.
you. Thank you. So this Lasix is a water pill and pulls off excess fluid from your body. It's normally taken very early in the morning when you wake up and latest by 4 p.m. The reason being that it makes you urinate a lot.
Yeah, I know. I don't
So
like
when
that,
you
though.
take it at nighttime, it will keep you up at night. So it's once a day. So take it in the morning with your morning medications.
Okay.
The other medications that they were changed were you were on amlodipine 5 milligrams, but your blood pressure was high, so they increased it to 10. Do you have your new amlodipine on?
I do. This is the new one.
Thank you. So 10 milligrams once a day, taken in the morning with your morning medications. These two medications, amlodipine and Lasix, can affect your blood pressure, make it low. So while you're on it, we need to keep an accurate eye on your blood pressure to prevent low moments or to make sure that it's working so that your blood pressure is not too high. Thank you. The other medications you were on before. Show me your aspirin.
Here's my aspirin.
Thank you. 81 milligrams. How about your lactulose? Thank you. This lactulose is taken as needed for constipation. So if you have any constipation, it says to take it every 6 hours as needed for constipation. If you're not constipated, don't take it.
Okay.
Thank you. How about your levothyroxine? 50 milligrams, and this is for your thyroid, is taken first thing in the morning on an empty stomach. So what I tell patients is, it has to be taken in isolation from all the other medications. So when you wake up at 5 a.m. to go pee, you can take it and then go back to sleep. So by the time you're ready to eat breakfast, it's already taken.
Okay.
Then your melatonin,
Yeah, I take that for sleep.
good, and that should be taken at bedtime. How about your rosuvastatin? What do you take that for?
I think that's for my cholesterol.
It is for your cholesterol, and it's also a bedtime medication. Thank you. These medications, however, were discontinued. No more docusate-colase, no more hydrolazine, no more insulin, and no more Ozempic. Remember, your sugar numbers were stable, so they took you off your Ozempic and lactulose.
I did stop.
So we'll put those aside so that we don't get confused with them. The other thing the hospital wants you to do is to follow up with your doctors, because they think that you don't need injectable insulin, but you would benefit from something that is taken by mouth. So when you go for your doctor's appointment, it will be something we mentioned to them. They would already see it in the DC summary for them to recommend something for you. Is that okay?
Yeah, that's okay.
Thank you. You have been awesome today. Few things I want to point out to you. I know you have a blood pressure machine.
I do.
So every morning, I would love for you to take your blood pressure and record the number here, date and time, put your blood pressure and your pulse, which is the third number on the machine. Put it here. And then your blood sugar. Remember, you are no more on insulin or any glucose, any diabetes medications. So we need to keep an eye on your diabetes.
Okay.
So take these numbers, put them down. When the nurses come, we can show them. The other thing that we want you to keep an eye on is your weight. You are on Lasix. You want to make sure that your weight is not going up, because people who have heart failure, which you do, we keep an eye on their weight. If their weight goes up 2 pounds in a day or 5 pounds in a week, it's reportable to the doctor, because for the most part, they have to tweak their water medications. So let's keep an eye on it.
Okay.
Any questions for me?
I don't think so. No.
Thank you. Thank you so much. Appointment with your doctor. It's called a hospital follow-up appointment. Your medications are all set. We took away the ones you don't need. We put together what you need. And you're going to keep an eye on your blood pressure, your sugar, and your weight.
Okay.
Thank you so much, and you have a wonderful weekend.
Thank you.